Medicare's prescription drug coverage can be a complete scam and a total waste of money for certain people. So in this video, let's talk about how prescription drug coverage looks like. How does it work? And what you should be looking at to not be getting ripped off when it comes to your prescription medications. I had a client today that when we went to the pharmacy, they were asking him for $2,000 for his medication, but with a little bit of research, we got it down to $60 only through a few options. So follow along so I can share you these inside tips as well to, again, avoid penalties, but to also save your money on prescription medications. I'm Emily with the Medicare Coach. We are an independent Medicare consultant helping our clients navigate all parts of Medicare to protect their healthcare rights as well as their retirement savings. And in this session, we're going to talk about Medicare Part D drug plan. So let's talk about how this is coming up, okay? I have a client right now. He happens to be HIV positive, but it could be for anyone. And he was at Rite Aid, the pharmacy Rite Aid, for a long time, but they just went bankrupt. And so he had to move to CVS. And when he moved to CVS, they're asking for $2,000 for his 90-day supply of one medication, which he can't afford. And I completely understand that. So he emailed me and he's like, panicked, right? And I get it. And he's like, can you help me, right? Can we figure out a way to get my $2,000 a lot less expensive than that, right? So I want to talk about what these rules are and kind of what we did for him to get his price from $2,000 down to $57.96. So number one, Medicare rules say by the time you're 65, you either have to be on a Medicare's prescription drug plan or have some other prescription drug plan that is deemed creditable. So creditable means the plan on average covers medications as well as or better than Medicare. If you're on an employer plan, the company is legally required to confirm this detail with you every year. So it could be an employer plan. If you have VA benefits, then that can meet Medicare rules. Retirement plans can often do that as well. So my point is this: Medicare rules exist that you should have a Part D drug plan or you might face penalties. Now, we have some clients who are better off not getting a Part D drug plan, but it's mainly because they, one, take no medications, but two, they have a high income. And so therefore that would result in their high income penalties. So most of you should have some sort of Medicare prescription drug coverage unless you have a high income, and then it's more of a conversation. Now, number two, there are a lot of ways to get Medicare's prescription drug coverage, whether it be through Medicare Advantage or Medicare Part D. Most of our clients end up on original Medicare because of the process that we have in place and kind of how their priorities and their situation fit into it. So most of our clients will have a Medicare Part D drug plan. Here's my thing with Medicare Part D drug plans. The commissions on them are so low that most people out there don't find their best Part D plan because they're never really told about them. So there is a process to find that Part D drug plan, but I find that most insurance agents, especially at the big places, are not thorough and thoughtful about it when it comes to recommending plans that can lead to big medication costs. So there is a process to find your best Part D plan. And so do the research. We do this for all of our clients, but we're looking at what are their medications, who is their pharmacy, and what other options do we have to get their coverage. So for this client, when he came to me, right, we did this research back in October, so we had him in a 2024 plan. But he came to me, right, panicked. My Rite Aid pharmacy closed down. I have to go to CVS or XYZ pharmacy. What can I do to get us done on cost? So I know that with it being mid-year, I can't change him Part D drug plans, right? We can't do that until between October 7th and October 15th to December 7th, and that new plan will start January 1st. But I knew we had a few things to kind of play with. So one, I went into his current Part D plan to figure out, are there any other pharmacies that have a fairly low price for that copay? And the thing is, for basically all places, a 90-day supply is around $2,000. So I really couldn't move the needle on his current plan. But what I did do is while Medicare rules say you have to have a creditable prescription drug plan or some type of Medicare prescription drug plan, you can still use the coupon programs. So we look at a couple of them, whether it be GoodRx, Single Care, Cost Plus. There's multiple out there that we look at. But in this case, GoodRx happened to have a coupon for $57.96. So I was able to send him that coupon. He was grateful that we just saved him $1,900 and some dollars, right? And he can get his medication, right, for his HIV treatment, and he's good to go. So my point is this. When it comes to Part D drug plans, yes, there are rules. Really, when it comes to Medicare prescription drug coverage, yes, there are rules, and you should be aware of those to avoid penalties. I do recommend that most of you have a Part D drug plan. But number two, get the right plan for you. And number three, when you have medications, it can be worthwhile to understand what are the other coupon options out there to help save you money. I've seen clients also go to foreign pharmacies to get certain medications filled. So there are different levers that you can pull, but medications can be a huge cost for many people. And so if you are having a medication that's probably over $100 a month even, it's worthwhile to look at your options to understand, is there a better way to get that coverage to, again, save yourself money, protect your retirement savings, but also take care of your healthcare. So I'm going to include a link below for those of you who want some extra resources when it comes to Medicare to just make your life simple and easy and avoid mistakes. But again, it's all about helping you understand how Medicare rules work and the levers that you can pull to ultimately have the best healthcare possible. So if you like this video, make sure you give me a thumbs up. But again, thanks for joining me, and I look forward to helping you with more inside tips with Medicare to protect your healthcare rights and retirement savings.